Here are some things you can do to improve that quality of sleep. First and foremost, sleeping position that we want to avoid is sleeping on that stomach. That's because our body gets distorted. That body has to compensate by going one way or the other, and it's just not good at keeping that neutral spine. But if we're sleeping on our side, some things that we can start with by improving that quality of sleep is first the neck position. What we don't want is that head to be propped up one way or the other, and it stays neutral within our body. So I tell people to sleep with less pillows, less is more, and really kind of just supporting that neck so it falls in line, something like that. Next is looking at that leg in those lumbopelvic region. Typically when we're sleeping on our side, that top leg rolls forward, bringing that whole pelvis with it, causing a lot of rotation and pressure within those muscles. So the easiest thing we can do here is taking an extra pillow or another towel if we don't have one, putting it right between the knees so it creates a gap that's supported and that lumbopelvic stays neutral there. So we're as neutral as can be, improving that quality of sleep. Now if we're more on our back here, basically what we're gonna do is first look at that neck position again. So easiest thing to do is reduce the amount of pillows so the head isn't propped up too much, but we can also put a towel, rolled up towel underneath that neck so that neck is supported but that head can fall back in that neutral position. There are cervical pillows that you can get, but I always recommend starting with a towel first to see how that feels because everyone is different. Next is kind of more if that low back starts to get tight on us. The best thing that we can do here is instead of putting a pillow between the legs, moving that pillow underneath our knees here, that props those legs up, relieving that pressure that builds up in that low back. Those are just some great tips that we can do on a nightly basis to improve that quality of sleep. But first and foremost, we always want to make sure that we're getting adjusted.